So now, good morning, everyone. I've got a message that we can start. I hope I'm audible.
Yes, all loud and clear, I hope.
Thank you.
Yep,
So,
go ahead.
yeah. So, welcome participants. I welcome you all for the webinar on fundamentals to the global health supply chain and vital role in India. And it's been our pleasure to have some eminent speakers with us, which is Professor Paul Lalwani, Professor Andy Bucklow, and Mr. Walter Proper. So, and also we were very much thankful to Jamia Hamdard University for helping us in organizing this webinar. So let's move ahead. Next slide, please. So some housekeeping announcements. I would request everyone to mute your mic and please turn off the video. It will help you improve your streaming quality. And also please ask questions through the chat box only, and definitely you can raise your hand, but yeah, the question should be put on the chat box for us to reply. Please participate in poll. There will be interactive polls, and that will help you out, to participate better. Webinar recordings will be available with the Jamia Hamdard University team and also with our team and on the YouTube channels. So you can go ahead and see it again. The slide deck will be shared with all the participants, so no worries you can note down your points, but definitely the slide deck will be there. Please fill in the feedback form at the end of the webinar so that we can get you better and understand your requirements. Next slide, please. So basically the agenda of the webinar is that, we will be talking more about the global public health supply chain in India, specifically the importance of it in India. And then at the end, you will come to know about some courses and the career options which you can choose in global health and supply chain. And there will be an open discussion and Q&A and few questions which are, you feel that you need more details, you can just ask us and we'll send you the details via mail. And then there will be summary and closing remarks. Next slide, please. So mainly the objectives of the webinar is to let people understand what is supply chain management per se, and specifically what's happening globally, and what is the vital role India is playing in terms of the supply chain management. What are the potential career opportunities available in global health supply chain, and some of the key organizations which are involved globally, which are supporting the supply chain management. Next slide, please.
Good morning, everyone.
So I will now request Dr. Ray Chaudhary to please introduce Professor Dr. Ahmed Kamal. And
good morning, everyone. Am I audible?
Yeah, you are audible, Dr. Ray Chaudhary.
We have the pleasure of our Honorable Pro Vice Chancellor, Professor Ahmed Kamal, to inaugurate this webinar. He was a former outstanding scientist head at Indian Institute of Chemical Technology, Hyderabad. He was former project director at National Institute of Pharmaceutical Education and Research, and he was awarded the Best Patent Award from Indian Drug Manufacturers Association. And he's also been awarded the Most Outstanding Researcher in the field of chemistry. Sir, I call you to deliver your inaugural speech words.
Okay.
Thank you.
Good morning to everyone. I hope everyone hears me.
Yeah, sir, we are able to hear you.
Okay.
Thank you.
So, first of all, let me congratulate all of you for holding this webinar on a very important topic, particularly in the present times. See, basically the supply chain management with respect to healthcare is a very vital thing, and I think this has been felt very much with respect to while we have been addressing the pandemic and other issues relating to pandemic. And most of the countries, most of the governments have practically awoke. I mean, they have awakened from on this aspect to bring in more robust type of systems. See, when we are really talking of this supply chain management, there are various factors which are very important. I think most of you know that. First and foremost being the investment costs, then the procurement costs, and also the production, and so many other aspects. And what is expected is we need to have some sort of affordable aspect, which is very important, and also efficient. So we will have to balance on these aspects. And in this context, I think India has tried to do its best in the last couple of months to bring this particular supply chain in some sort of a system where we bring that robustness. And I would also like to mention that, as I mentioned, the affordability for countries like India and also many other countries is also a very important aspect. See, having this in place, but if the general people can't afford it, that will be of no value. So this particular balancing act, I think the management, we'll have to look into this management very carefully that way. Because how I mean, with respect to the production, to transport, to, I mean, procurement, all these things are balanced properly with respect to the economics of the whole system. And also, we will have to see the demand aspect and how do we go around on this. So these are some of the aspects which we need to deliberate. And I'm sure in today's meeting, you all will be doing all these. And my thinking is that there is a lot of scope, because we have seen, I mean, particularly in these last few months, issues coming with respect to various healthcare organizations, including several hospitals, how they could really cope up with respect to certain demands. Although, as I mentioned, that we try to prepare with the large number of, I would say, ventilators, nebulizers, and things like that in this particular aspect. But in general, if we see the type of survey we need to do, that what are the real requirements from time to time, and the type of issues what we have specifically during a period. So these surveys have to be conducted in a very effective manner so that our supply chain can get prepared accordingly. Because the thing is, again, everything is so much interrelated. So you go for a procurement, but unfortunately, if you don't have a production of that, you don't really can do this effectively. So all this planning is very important, I feel. And I'm sure that these deliberations of today would be of great value and could really bring some sort of important assessment of the whole system. So without taking much of your time, I would like to wish you all the best, and hope you would all enjoy this particular webinar on a very important and, in fact, practically, I would say, useful topic of today on the global health supply chain and what India could do in this. And my thinking is the challenges what India could face today could be turned into opportunities. And there are wonderful lessons, excellent lessons that have been learned during the last couple of months, where there was a lot of panic in the beginning, but things were managed so well. And we could definitely do much better in the coming days. So thank you very much, and look forward to have one wonderful meeting on this. And I would like to compliment the organizers for having such a webinar on this particular topic. Thank you so much.
Thank you, sir. Thank you so much.
Welcome, welcome.
Over to you, Professor Ray Chaudhary.
Yes, good morning. Myself, Dr. P.S. Ray Chaudhary, one of the moderators. I'm a faculty in the Department of Healthcare and Pharma Management here in Jamia Hamdard. I worked in supply chain management, operations and industrial marketing in the industry, and of late in pharmaceutical and healthcare. And I teach these subjects and I guide doctoral students also. My colleague, Dr. Saki John, he's a public health academician and professional with 24 plus years of experience. And he has worked extensively in material and inventory system and inventory management system, information system. He has been working on national and state level programs. Next slide, please. I have the privilege to introduce eminent panelist, Professor Paul Lalwani. He is founder and director of Empower School of Health, which was founded in India and is present in more than 10 countries. He is deputy chair of People That Deliver and founder of the Center for Digital Learning in Global Health. He was the former head of procurement and supply chain at Global Fund Geneva and has advised WHO, World Bank, and UNICEF, Gates Foundation, and several other organizations. Next slide, please. Good morning, Professor Andy Paraclaw. He is a professor of public health and director of training at the Empower School of Health. Andy is one of the co-authors of the Yellow Book, often referred as the Bible of managing drug supplies by MSH and WHO. He has 25 years of experience of working with USAID, DFID, Management Sciences of Health, and has worked across more than 40 countries. Next slide, please. Good morning and welcome, Mr. Walter Proper. He is the Executive Director of International Association of Public Health Logisticians. He has over 30 years of experience working to improve public health system in Global South. He's been the experience as a Zambia country director for USAID, and he has worked extensively in the areas of HIV and AIDS, and he has worked in more than 30 countries. Next slide, please. These are the partners who have collaborated today for this beautiful webinar: Jamia Hamdard University, Empower School of Health, International Association of Public Health Logisticians, and International Federation of Pharmacists. Next slide, please. About Jamia Hamdard University, briefly. This was started in 1906 by our late founder, Hakim Abdul Hamid Saab, who was a well-known practitioner in Unani medicine, alternative system of medicine in India. And he wanted to transform this into a scientific discipline. And he gave name Hamdard to this venture, which means sympathy for all and sharing of pain. The university formally was inaugurated as a deemed to be university in 1989 by our former Prime Minister, late Mr. Rajiv Gandhi. And we are proud of our inclusive culture and traditions. And we are home to nearly 10,000 students from India and across the globe from more than 35 countries. So it's a truly an international institution. And we have found our place among the select few universities. And we are greatly funded by many funding institutions. We have high quality research pool of researchers pool of experienced faculty members, and a strong alumni network which is spread across the entire globe. Next slide, please. We are fortunate enough to have the key persons in the university. Our Honorable Vice Chancellor, Padma Shri Awardee, Professor Syed Atesham Hasnain. Our Honorable Pro Vice Chancellor, who just now inaugurated, Professor Ahmed Kamal. Our Dean, School of Management and Business Studies, Professor Ravichandran. And Professor Shibu John, Head of our Department of Healthcare and Pharmaceutical Management. Next slide, please. Jamia Hamdard has been recognized as an institution of eminence among very few select universities in India by our Ministry of Education, Government of India in 2019. And we have been also ranked very high among the National Institution Ranking Framework, in 2019. And our pharmacy faculty is ranked as a top. And we have a QS World ranking between 150 and 200 and Times ranking between 800 and 1000. And we have been, endowed with many fellowships. These are the milestones from 1906 to 2020. Next slide, please. We have many academic collaboration and industrial collaborations. This is the list of the various universities we have tied up with. We have also the industrial training partners. We have certain industry partners who have their R&D in our campus, including Sun Pharmaceuticals, BD's Biosciences, and we have also various involvement of research activities, and we are endowed with a lot of fellowships and research goals and research and development collaboration with various institutions and organizations. Next slide, please. We have developed many technologies and registered many patents in the area of TB and other areas. And we are also fortunate enough to be, our graduates are hired by various healthcare and pharmaceutical organizations and consulting organizations whose brand symbol has been displayed on the screen. Next slide, please. About Department of Healthcare and Pharmaceutical Management, which has taken the lead in organizing this webinar with Empower School of Health and other partners. And this was started in 2005 under the School of Management and Business Studies. And we have a very inclusive curriculum. And we involve contemporary concepts, field assignments, internship projects, practical case studies, and industrial assignments also. And we have a good student quality over here. And the course curriculum is well tuned with the current industry and the global standards. We have the following courses: MBA Health and Hospital Management, MBA Pharmaceutical Management, and we have also the 2 doctoral programs in Health Management and Pharmaceutical Management, where we are undertaking a lot of research into the management areas of health and pharmaceutical, including supply chain also. Next slide, please. These are the distinguished faculty members of our department, headed by Professor Shibu John, Professor N. Ravichandran, Dr. Muhammad Fazal Khan, myself, Dr. Ifat Naseem, Dr. Saki John, Dr. Jawad Khan, Ms. Ashia Faruqi, and Mr. Ubada Akil. We have faculties in various areas of healthcare and pharmaceutical management, including that in marketing, operations, epidemiology, quantitative methods, health process engineering, pharmaceutical supply chain, operations and pharmaceutical marketing, and brand management. Next slide, please. I request now Professor Lalwani to take over from here.
Thank you very much. Excuse me, just to confirm, you can hear me okay?
Prof, we can hear you. Please carry on.
Great. Professor Ray Chaudhary, first of all, I think you must add Empower School of Health in your placement slide. As you know, Rahul is one of your alumni and he's working with us. That's number one. And,
thank you, Professor Paul Lalwani, for mentioning this. I wanted to say this, but yes, I'm very much privileged that I'm an alumni of Jamia Hamdard, did my pharmacy in 1998, and now we're working with Empower. So please carry on, sir.
Thank you.
That's wonderful. And he, of course, is the bridge that brought us together as well, which is great.
Yes.
I'd like to start off, first of all, by thanking Professor Ahmed Kamal for his comments, and first of all, also being present and inaugurating this particular webinar. Given your background and your experience, it really is an honor. As you mentioned, I'd like to underscore a couple of points that you mentioned, which are really important. One, you said it's a very timely topic, which is absolutely right. Health and supply chain during the time of COVID and crisis management is exactly an area of work we must address. India is struggling to respond. The number of deaths are increasing, the number of cases are increasing, and we must respond actively, both in terms of products, in terms of supplies, the supply chain, and the actions that we take. And like you rightly said, how can we turn this crisis into an opportunity? And it's very similar to what India did in the 1990s when there was the HIV/AIDS crisis. And India stepped up to the global platform to respond to that. And Professor Andy will discuss more of that as well. The other point I'd like to highlight, which was mentioned both by Professor Kamal and by Professor Ray Chaudhary, is about innovations and patents. And both Professor Kamal has been awarded one of the best patents by IDMA, and the university is producing patents and innovations. While that is critical and important, as highlighted accurately, unless and until we have a system for buying, storing, distributing, and using these products that have been innovated, we will not achieve the necessary benefit around that. So the combination of science and the management of supply chain is something that's really vital, and it's an area that we've been focusing on for the last 15 years at Empower, and many of us who are on this panel for more than 25 to 30 years. So with that, we have a poll to make sure that all our participants, and we currently have almost 400, are awake, alert, and we get the sense of who they are. So with that, Andy, over to you to guide the process and just to describe what we are doing.
Okay, I hope all participants can now see the polling on their screen. We'd like you to complete the questions, and when you've completed, please press the button to submit the poll. By completing this poll, it helps us to guide and focus the way we make the presentation. So some general questions around there. Which part of the world are you from? Or what is your background? And that then allows us to concentrate more in particular areas where the most number of people are present. You can see shortly on the screen the results of the polling. And I see we have around 50 people polling so far. So if you would all go ahead and complete the polls over the next few moments, please. And by knowing which organization you're working with, it helps us again to focus this presentation more towards one particular area or another, depending on where the greater interest is. And I see that so far we have a very young following, with most under 30. So for the old men like me, we are in a minority, and I will try and concentrate in the presentation a little bit more on technology. We're about halfway on the polling now, so another few minutes, please, to submit your poll questions, and then I'll just take a moment to go through the poll. Okay. And, okay. And by far the majority of our participants are from India, followed by Africa. And it looks like the majority are studying at postgraduate level, and the majority are in management and engineering. Okay. And where do you work is a complete mix of all areas. Okay, just one more minute for the poll, and then we'll stop the polling and have a quick look at the answers. I see our gender balance is coming out almost even. That's very reassuring to know.
Indeed.
Okay, and we have a very young audience with the majority still under 30 by far. So again, our focus will be a little bit more towards the technology end as we deliver the presentation.
Right, and also career management and planning for the future, I guess combination of both.
Okay, we're just coming up to the 70% mark. Okay, we'll take another few seconds and then we'll okay, so we're at 3 minutes there. Let's stop the polling there and move on. So we have a reasonable gender balance, a very young audience with a majority under 30, majority are from India, and majority are studying at either graduate or postgraduate level. Okay. And academic background, we have management engineering followed by pharmacy. So we move a little bit towards the management more as we deliver the questions. Okay, thank you very much for taking part in the poll. We'll have another one shortly, so please do stay awake because we'll be asking questions throughout the whole of the presentation. Thank you for now. Okay, back to you, Prof. Paul Lalvani, to continue on the slide deck.
Right, thank you. And did we share the results, by the way? Or did we press this button? Can everybody see the results now?
Yes, Prof,
I know
we can see. Yeah, we can see.
Yeah. So gender almost 50-50, young group, as Andy said, mostly India, which was the target, which makes sense. Are you studying at the graduate or postgraduate? It's about half, and about 20% working. Pharmacy and management are the big categories. And in terms of work, it's mostly a mix, but some in academia, private sector, and ministries of health. Excellent. Okay. So it also gives the participants an understanding of who the others are as well. I move on. Okay. So let me close this. So about Empower.
Close the poll, please.
I'm sorry?
I'm saying we can close the poll now.
Yes, yes. I think it's already been closed. Can you see my screen?
Yes, we can see your screen.
Okay. So Empower's reach and impact, as I mentioned earlier, we are based in 10 countries now, and our participants, students are from more than 100+ countries. It says 100,000 learners reached. It's now 200,000. The slide is old, and more than 200+ organizations and over 1 million hours of training has been delivered. These are some of our partners, funders, and clients that we work with. They belong to government organizations, UN agencies, donor agencies, academia, and NGOs and implementing organizations as well. And one thing that we always focus on is partnerships across the globe, realizing that South-South partnerships are critical. We also do South-South and North-South partnerships, and across Africa and Asia, all the way to Mahidol University in Thailand in the east, Kathmandu University in Nepal, several partnerships in India, and the webinar with Jamia Hamdard University is a starting of that relationship as well, and across Africa into the Americas as well. And of course, we have a partnership with the International Association of Public Health Logisticians. In fact, Empower is the host for IAPHL in India, and you'll get to hear more about them as well. People That Deliver is another entity that works in supply chain, capacity building, and organizational strengthening as well. With that, I hand over the floor to Walter, who hopefully is still awake, given that it is about 2:15 in the morning for him. Walter, over to you.
Yes, coffee does wonders. I am awake. So thank you, Paul, for inviting IPHL and myself to be part of this esteemed panel talking about sort of the future of and the work in supply chain. So I'm the executive director of the association. Next. And so what is IPHL? So we were founded in 2007, actually by JSI, the organization that actually supports the Secretariat. And we're a global community of practice that really promotes our people to develop their professional skills in public health supply chain management. We currently have more than 8,200 members and growing. We have more than 150 countries worldwide, and our members come from more than 150 countries. And we provide a key platform so our members can network, talk to each other, exchange ideas, improve professional skills. I would say for our young audience and for students, it has been a platform that has been very useful for students who are looking like, what should my thesis should be, or what my dissertation should be, what area of study. People are very forthcoming to help advise, and they get both academicians who immediately will give answers from all over the world, and old practitioners like myself and Andy and others to help as well. So just again, to keep that in mind it's one of the benefits, and we've seen a lot of support for our members on this. Currently we have 23 country chapters. The last chapter to join actually is the US, and that's partly because of the COVID crisis here. India chapter, which I actually went to the opening for, is becoming one of our largest. Interesting, the India chapter has been dominated by the private sector, which has not been the case for other chapters, which tend to be dominated by the public sector, from the government sector. So it's very interesting for India. And in order to be a member of the chapter, you first join the International Association, and then you can join the local chapter. As it says there on the slide, it's very easy to join. You just go to the website, and it's free. So it's a bargain, as we say in the US. Next. So just to show a little bit about our growth, again, we started in 2007, but starting from 2011, when we're under 1,000, you can see the growth every year has been exponential, and it continues to grow. And I hope India now will also increase our growth. And I believe when I opened the chapter, the target was 500 members by the end of last year. We haven't quite achieved that. And I know Paul wants to grow it even further. So I do hope with this, we're catering to the India population, that we get a lot of new members from India. So next. So where our members are, you'll see that 70% of our members come from Africa right now. For some reason, the percentages are not showing on here. That's interesting. That's 70%. Well, the gray area is actually 11%, which is Asia. And Asia is tied with North America currently. So after Africa, then it's Asia and North America. And then we do have Europe and Central America, and even some very tiny islands in Oceania. One just joined, so I think we now actually have more than 100 and possibly 152 countries represented. Okay, so again, I'm going to end to say, join. This is really focused on the Global South. People exchange ideas, but you get ideas from all over, all levels, and we encourage our members, whether they've had 1 year of experience or they've had 30 years experience, to share their ideas and exchange ideas. So thank you.
Right, so just before I pass on to the next slide for International Federation of Pharmacists to Andy, just want to underscore what Walter just said. So the International Association of Public Health Logisticians is an incredibly valuable platform for anyone working or studying in the area that's linked with health supply chain. It's the only one of a kind. They've been running it for more than 10 years, as you've seen. And we Indians are hyper competitive people, as you know. And right now, sitting in, second, third, fourth spot is just not good enough. I've committed to Walter that we'll see easily 1,000 people by the end of the year, which is still very small given our population and given our interest in this area. So, and of course, it's free of cost and it's very valuable. So I recommend and encourage everyone to join the platform, and we will continue to manage, maintain, and provide additional support from India, of course. Okay, thank you.
Just to add, Prof. and Mr. Walter, I have also put the link to join the India chapter in the chat box for everyone. So you can also click on that and join later on. And definitely the global chapter, as per Mr. Walter, you can join and stay connected for the new international updates in the field of supply chain management. Thank you, everyone.
Thank you.
Andy.
Okay, so FIP, we use the French language acronym, Fédération Internationale Pharmaceutique, the International Pharmaceutical Federation, which is the global body to represent pharmacy, pharmaceutical science, and pharmaceutical education. Over 150 countries are involved. It's more than 100 years old. It is not free to join, but for pharmacists, it's a good idea to join. FIP frequently involved at the global level, promoting the role of pharmacy and working extensively with the World Health Organization, developing practical policies and procedures. If you've not already heard of good pharmaceutical practice, you should look it out and find out what it is, because it is most effective and is really something for all pharmacists to be following. Also, coming soon to a place near you is the World Pharmacy Week. And this year it's a virtual program because, of course, we're under COVID restrictions, but 21 to 25 September is the World Pharmacy Week. And since half of you are pharmacists, please do look online and do get involved in promoting pharmacy and pharmaceutical efforts, especially for global health supply chain during this time. Okay, move on, please.
Thank you, Andy. And just to mention, this is also on the 25th of September is World Pharmacists Day. And the theme for that is global health, transforming global health. So those who are interested. And so again, FIP is pharmacy oriented and for pharmacists. However, IAPHL is general. It's for management staff, it's for logisticians, it's for engineers, anyone working in the supply chain sector. So just to make that distinction as well, especially since more than 50%, 60% are non-pharmacists. So with that, about global health supply chain, we have poll number 2. Andy, over to you.
So once again on the poll will appear on your screen shortly. Please answer the question. Please select only one option for each of the questions. So have you previously worked in health supply chain? So it's split up between no or the length of time, 5 to 10.
Sorry, just to split up. I'm sorry. The first one is, have you previously worked in supply chain?
Sorry, in supply chain.
Any supply chain. The
Yep.
second one is in health supply chain.
Yep.
Right. So just so that the audience is clear, the difference between question 1 and question 2. And yeah, Andy, back to you.
Okay, so I see the votes are starting to come in already. It looks like everyone is familiar. Just one option, please, on those. Are you familiar with the Sustainable Development Goals, the SDGs? Previously were referred to as the Millennium Development Goals. These are the international global guidelines for development. And then just a simple question, if you're familiar, how many SDGs are there? And I see we're about 40% on the voting now. Okay.
Looks like the participants are getting better at polling. They're moving rapidly.
They're moving, yeah, over 50% now. We're doing well. Okay. So it looks like a lot of you have not previously worked in the supply chain. and not previously had experience of the health supply chain? Okay, for SDGs, we're coming up with, most people have heard of them, but have not really been involved with them. Okay.
Yeah, Andy, given the response of have not worked in health or public health supply chain, but obviously there's a strong interest, let's make sure that our communication then is at a level that allows them to basically the fundamentals, and which is how we mostly kept this rather than going into the technical.
Right. Okay, we'll certainly modify that to keep to the basics of supply chain operations. Okay, just another few seconds to get all the results in. Okay. So once again, majority of people have not previously worked in the supply chain, but we're all here today, so you're obviously greatly interested in it. So towards the end of the presentation, we look at career development in supply chain, which I believe will be of particular interest to the participants today. And then finally, how many sustainable development goals? We have a pretty even split across all of them there. Okay. Yeah. All right, we're at 3 minutes, so let's stop the poll there and show the poll results to everyone, please.
Yeah, so Andy, do you want to run through the results?
Okay, so the results are majority of people have not previously worked in the supply chain, 84%, and that's the same for the health supply chain. Familiar with sustainable development goals, most people, nearly 60%, have heard of them, but have not previously really been involved with them. And how many sustainable development goals do we got? Well, the peak is for 17. Shortly on the slides, you'll be able to find out exactly how many there are.
Excellent. Thanks, Andy.
Okay. All right, so we can stop sharing the results now.
Yep.
Okay,
and with this,
then,
I hand over the slide to Walter to take over the slides from here. And Walter starts with a video, so requesting the team to get the YouTube video started. So Prekshan team, if it's ready, if we could please have the video, and then we get going.
A public health supply chain aims to get health products from where they are made to the person who needs them. A vaccine to immunize a child, a rapid test kit to test a sick patient for malaria, and the medicines to treat her if she tests positive. Contraceptives for women and families, so that this child, this woman, this family are happy and healthy. The process of getting health products to people involves many people working together on various activities at different points along the way. A health program manager to estimate the number of products needed to treat patients. A central medical store clerk who picks and packs products. A driver from a transport company who delivers products to health facilities. Supervisors who make sure staff with logistics responsibilities are supported in doing their jobs. Pharmacists and other health personnel who dispense products. Community health workers who provide products to people at the last mile. A public health supply chain also includes funders, manufacturers, distributors, procurement agents, and private sector partners. This great variety of people and organizations become connected from the top to the bottom of the supply chain. They agree to work together towards a common goal, understanding the role each of them plays in getting products to people. They share and use information about demand, need, inventory, and transportation, so their activities are coordinated and all supply chain partners perform well. An integrated supply chain is strong from end to end, yet has to be flexible and dynamic to adapt and respond to unanticipated changes or challenges in the environment. This end-to-end integration has transformed the way commercial companies like Apple, Procter & Gamble, and Walmart operate their supply chains. helping them to deliver quality products on time and securely to customers, and greatly enhancing those companies' market share and bottom line. Integrated supply chains can be as transformative in public health as they have been in the commercial sector, delivering health products to people when and where they need them, and greatly improving customer service and health outcomes. Improving health is the bottom line for public health supply chains. Lessons from the commercial sector teach us that integration is more than merging health programs. For example, putting malaria and AIDS products on the same truck, or offering family planning and immunization at the same site. Deciding which products to manage together is only one piece of the integration puzzle. Strengthening the supply chain from the very top to the bottom is another. It requires linking people, information, and activities from where products are made to the people who need them. A strong, integrated supply chain delivers health products to the child, family, and community whenever and wherever they need them.
Thank you. Walter, over to you. Let me share my screen again. Where are we at? Walter. Walter, are you there? Walter, we can't hear you, so I'm going to continue until I hear your voice. Okay.
Mr. Walter is
Can
on
anybody
mute.
else?
He's on
Okay.
mute.
Walter.
Prof, I suppose you, oh, he's here.
Yeah, yeah.
Yes, I was muted by, by forces beyond my control.
There you go. Yes, I understand. It happens. Over to you, Walter.
Yes, okay. Thank you. So again, given our audience, and I hope that video was informative and produced by the actual organization I work for. So we're going to talk about the right to health. So there's the basic principles. They've been around a while, as this slide shows. The whole idea that health is a fundamental right, and as it should, the World Health Organization in 1946 said this was a fundamental right. It was again in the Universal Declaration of Human Rights. And of course, for us in supply chain is, well, you need, in order to have the right to health, you need products. Many, many years ago, actually, JSI came up with the idea of no product, no program, that it used for many years to say you can have the best program, but if you don't have the product there, you don't have your program. So I think that's basically what this is about for the supply chain part of this. Next. So for those on defining the health targets, as Andy said, as you can see, 34% of you got it right. There are 17. Don't worry about it too much. It did change, it grew. There were fewer before, and then the last reiteration they came out with 17. And of course, the key one for us is number 3, good health and well-being. And again, saying that these are the sustainable development goals. All the countries are being rated on how well they're moving on each of these. And of course, we're concentrating on number 3, how well are you working on good health and well-being? Next. So then looking further into that, what is that all about? Reducing illness, ending preventable deaths, ensuring universal access to sexual reproductive health products. But all of these, in a sense, again, in supply chain, means you got to have a supply chain that can support it. And unfortunately, as the heading says, less than half of the global population is covered by essential health services. And a key to that is also having the medicines. Next. So all of these require products, as I said. So you can't have a good measles campaign if you don't have the products to test and treat. You know, having ORS or for antiretrovirals and stuff. And I work extensively in this area for a long time in different countries is as the HIV AIDS pandemic hit, and then trying to get the products out as products came. And I'm hoping very soon for COVID that the issue is how to get the treatment products out to the world and to the people. And again, as you know, the testing has already been a challenge to get the test kits out to where they need to be. So again, it is no product, no program, and that's where those of us working in health supply chain have been trying to make sure that we have the products there. There's a lot to the health program. There's a lot that goes into it. And our key thing is, but it's got to have a supply chain that works. It's got to have the products there for the people when they need them, regardless on how great your program is. So as it says, we're vital to the components. Nearly 2 billion people globally have no access to essential medicines. And sometimes that's because they don't have the supply chain to get them there. And others, of course, some countries don't have the products coming in. You know, India has led the way, and I think there's gonna be a little more talk about that in providing a lot of the generic products, which really brought down the cost. Certainly for HIV/AIDS, it was a game changer to be able to have products at reasonable cost. But that's what we're about. That's what IPHL is also about. And that's what the health supply chain work, a lot of what it's done. And it takes the private sector and the public sector working together to really help people. Thank you.
Great. Walter, thank you. Perfect introduction. That also picks up on the point that Professor Kamal had mentioned earlier in terms of affordability of products as well. So the former Director General of WHO made a very clear statement at the World Health Assembly and said that all donated drugs in the world won't do any good without an infrastructure for the delivery. So whether it's donated or developed or manufactured, that's all wonderful, but unless we go from the lab or the factory all the way to the users and the beneficiaries, we will have no impact, and that's where supply chains come in. Earlier, we had talked about the pandemics and how they are stressing the supply chain. If you take a look, and this is, you know, we've had several either epidemics or pandemics over the years with large numbers of deaths occurring for more than a century. Often this particular pandemic has been compared to the Spanish flu of 1918, 1919, 102 years ago, which is estimated to have killed 40 to 50 million. Obviously, we're nowhere near that, but we're also not out of the woods with the current pandemic. Right now, it's approximately 25 million confirmed cases. Obviously, we all know it's grossly underreported and almost hitting 1 million deaths since its outbreak sometime late December, early January, when it started to spread and scale. And not only is it stressing the fact that the supply chains for the products that are needed to respond to this pandemic, but also all the other supply chains are being affected as well. When we talk about supply chain, again, keeping it at both a simple but at a very important level, is we're looking for the 6 rights, the 6 things that we must get right. First of all, getting the right medicine in the right quantity for the right patient at the right time, in the right condition, and at the right price. So in a very simplistic way, but in a very important way, these are the 6 rights we need to get done if we are to succeed in effective procurement and supply chain management. And when we talk about types of health products that need to be procured, distributed, and used, you've got vaccines, you've got medicines, you've got diagnostics, and of course, there's a whole range of other kinds of products, which could include microbicides, vector products, etc. And what's interesting is there's more than 400 products in the pipeline for communicable diseases. We're just talking about communicable diseases here, vaccines, diagnostics, and medicines. Many of these are going to eventually reach the market, and the countries and the public health and the private systems need to then absorb them into the system. So imagine going from innovation to introduction into a particular country, into getting it to the last mile, the user, the primary health clinic, or all the hospitals. It's a difficult task, and it's a task that must be done on an ongoing, regular basis. And the rate of innovation is only increasing. That's jumping, let me just jump, okay. So the steps involved in product introduction and procurement supply chain, when we talk about it, we start with R&D, you create the new health technologies, they get approved, not only by one regulatory authority, but by each country approves it before it enters. You select and prioritize the products you need. There's procurement, purchasing, whether it's public or private sector. You distribute and store. You service delivery, the actual use in clinics, hospitals, primary healthcare clinics, patients benefit, and we ensure that there is safety monitoring. And this is the area, the red box is where the procurement, this is what's referred to as either access to medicines in a broad way, and more specifically as a subset, procurement and supply chain management. At Empower, we've converted this into a framework for learning, just so that you see at a high level the different moving parts. How do you take something very complex, very global, and at the same time very local, and convert it into a framework for learning? And so there are three broad categories. So let's say if you are at a national level, you're working for the Ministry of Health. It could be for a public health program such as HIV/AIDS or reproductive health, or you might be simply working cross-cutting for the central medical stores. And India has both central and at the state level. So there's the overall structure you have to think about, very much like you would if you're running a company. The organizational structure, the policies, guidelines, and manuals. Then the next level is the actual supporting functions. Do we have financial management, human resources, information systems, proper communication and coordination, and do you have the right infrastructure? And you saw some of these points mentioned in that very informative animation that Walter presented, which was done by JSI, one of the leading organizations in public health supply chain. And only then do you start looking at the procurement and supply chain functions, which is the planning of PSM, the product selection, the forecasting, how much do you need, getting the procurement done, managing the inventory, distributing, and ensuring appropriate and rational use. And throughout the entire process, ensure quality, not just for product quality, but process quality. And then you measure the performance of each of these indicators, getting indicators to measure the performance. Now, this is challenging in most circumstances already, but now imagine doing this at scale, at speed, in a pandemic type environment when everything gets broken down. And Andy will discuss that with you in a few minutes. The stakeholders involved, you have, again, this was mentioned in the short video. You have the product developers and manufacturers, you have your donors, your regulators, the ministries, the supply chain organizations, and advocacy. And of course, none of this works without organizations like Jamia Hamdard University and Empower, the academics that support capacity building for these entities and these individuals. With that, I hand over to Professor Andy Barraclough, often referred to as the encyclopedia of supply chain. Andy, over to you.
I'll try and share my screen now then.
Okay.
Yep, good. Okay. Okay, is that displaying well for everyone?
All good.
All good,
Okay.
Prof.
Okay, here we go. Okay, so what does this global health supply chain that we've talked about have to do with India? Well, if we think back 20 years ago, it was the height of the HIV/AIDS epidemic. There was a major problem. The medicines which were available were very expensive. They were from Western drug companies, they were brand name medicines, and they cost about $10,000 per patient per year. And in low and middle income countries, the majority of people just could not afford that kind of medicine. The Indian generic industry started manufacturing generic-based medicines at a much lower cost, less than $400, less than 1/25 of what the Western companies were charging. As a result of that availability, the HIV, ARV, antiretroviral medicines increased 18-fold. We went from an epidemic situation of HIV/AIDS to HIV/AIDS becoming a health problem to be managed. And that was due to the power of the generic industry in India, being able to manufacture low-cost medicines at high volumes. But it was not only the ARV medicines, it was all the generic medicines. We've had a similar situation around malaria medicines and TB medicines. And India is now being called the pharmacy of the world because of this ability to manufacture low-cost generic medicines. But if we look at the numbers are often very misleading. If we look at the revenue worldwide of pharmaceuticals, India is right down the list here at only 1%. How can India be the pharmacy of the world if it's only supplying 1% of the global market? And this is a common misunderstanding when we use values instead of volumes. We have to clearly understand the difference between value and volumes. And that's a problem because most of the Western literature, most of the Western statistics are based around values. In fact, India supplies over 20% by volume of the global pharmaceutical market and over 70% by volume of the world's medicines. But these are low-cost generic products. They don't have a large revenue. So on the value, it doesn't show up. But on the volume, it's huge. And understanding this fundamental difference helps us to understand the supply chain and the role that India can have in the supply chain. So Western health supply chains are generally handling high-cost brand name products. India health supply chains are generally handling high-volume, low-cost generic products. If we take the example of one pallet load, a standard warehouse pallet of antiretroviral medicines, using brand name products from the West, that would typically cost $10,000. If my transport cost was $500, that $500 equates to 0.5% of the medicine price. So my transport cost is negligible. I don't need to have a super cost-efficient supply chain. If I've got generic products, that same pack of antiretroviral medicines, now full of generic products, is only $1,000. If my transport cost, and transport cost depends on volume and weight, so it's going to be exactly the same, is $500, that's now 5% of my medicine cost. That's not huge, but it is enough to make me want to look at the supply chain costs. So the normal approach, even on private sector health supply chain throughout India, is much closer to what we need on global public health supply, because they're handling high volume, low cost products. They're used to having cost-effective supply chain. It's what they do every day. Just to emphasize this point around values and volumes, it doesn't just apply to India, it applies to all the global figures. If we look at the case of UNICEF, UNICEF is the United Nations Children's Fund, and it buys by value just 5% of the global vaccine market. Well, that's very small. It's not really significant. But because UNICEF buys low-cost generic vaccines, that accounts to 40% by volume. So UNICEF buys nearly half of the total global production of EPI vaccines, but it's only 5% by value. So the point here is that by using value figures, we often grossly underestimate the impact that countries using generic low-cost medicines have and the abilities they have in managing those. And we need to come closer to that because that's what we need for global health supply chain. That's the approach that we want to use. India has the global reach. It's the largest producer of generic medicines in the world. It provides over 70% of the global vaccine demand and 25% of all medicines in use in the UK. But again, these are low-cost generic medicines. And the Indian pharmaceutical market is predicted to continue growing substantially. But that's around manufacturing. The challenge now is, can India help to address the global supply chain? It's already addressed global manufacturing, but can it look at supply chain? And we'll explain that in the next few slides. The reality is that in the majority of public sector supply chains in low-income countries, there are many problems. If we look at the major global health programs to address HIV/AIDS, TB, and malaria, they have undergone massive investment over the last 10 to 15 years, and very significant health gains have been achieved. But for the value of the investment, the progress has been disappointing. And part of the reason has been the medicines have not got to where they're needed. The supply chain has not performed in the way that we would want it to perform. Further, as Professor Paul previously mentioned, there are many new products now coming onto the market which can seriously address global health issues. But how can we get them to the patient if we don't have a supply chain that works? Being able to cope now and being able to cope with increased volumes is critical if we are going to address health issues. And for that, we need functional supply chains. The pharmaceutical supply chain in India is able to cope with this. Hyderabad Airport already has World Health Organization certified good storage and distribution practices. It knows how to do. Many Indian pharmaceutical manufacturers already have World Health Organization GMP, good manufacturing process certificates. They know how to do it. We need to be able to harness that ability on the global stage. However, not everything in the supply chain in India is perfect. And recently we have seen the impact of low resilience. In order to achieve high efficiency and low cost, some of the resilience in the supply chain has not been present. The focus has been more on low cost and efficiency than it has on resilience. And what do we mean by resilience? Being able to cope with disruption. A simple way to cope with disruption is to be able to have buffer stock. I keep stocks in the warehouse in case there's a disruption of the supply chain. But that's not very efficient because my money is tied up in the stock if I'm doing that. So there needs to be a balance between efficiency or resilience. And meeting that balance is important, and recent events have shown that we need to redress that balance.
Andy, could you just take a break for 1 second? There seems to be markings on the screen coming on. I've just asked my team to switch that off because what's happening is that any of the participants, when they move their cursor, it ends up marking exactly what's going on right now. Rahul, can you please coordinate with the admin team so that they're marking that normally this is used when we are engaging and discussing and people are supposed to write. it seems to have been switched on. So could I request everyone who is in the audience not to use their marker button?
Prof, can we close the PPT and then once open it again? Let's see.
Yeah, let's do that. All right, so whoever's doing this, it's not very helpful. If you can please stop marking it, and Hitesh and team figure out how to stop the markings happening. Okay. Andy, go ahead, just do it again.
Okay. Oops.
You see the markings are appearing again. We have to switch that function off. Rahul, can you just bilaterally call Hitesh and the admin team right now to make sure, because it's distracting and it will prevent the focus. Yeah. Okay. Could I just request, yeah, we can't, you see, we can't proceed this way. Could I just ask everybody not to move your cursor while Professor Andy is speaking? Thank you. Can you please undo? Whoever's scribbling on the screen, can you please undo? And sometimes it happens without even you realizing. There you go. Thank you very much, everyone. Okay, Andy, let's give it a shot. Please continue.
Okay, so I'm talking about disruptions to the supply chain in India.
And disruptions to the presentation.
Right, okay. And I'm sure that before January of this year, most of you had never heard of Wuhan and Hubei province in China. Yet, they are the center for manufacturing of API, active pharmaceutical ingredients, for about 30 to 40 products. And that's important because India imports 70% of its API, that's the raw materials to make medicines, from China. So if there's a disruption in these raw materials, in these APIs, you don't get to make the medicines. So this is a lack of resilience being present in the supply chain. And that's caused some disruption. Fortunately, India has reacted quite quickly to address that situation. I'm just trying to get the slide to move on now. Okay. Okay. So India has acted to increase domestic API production in order to be able to address that situation in future. So my point around this is that although there's been a lack of resilience, activity has happened to help address that problem. And that's a key feature of the Indian pharmaceutical market, its ability to be flexible and to relax. And as you may remember from the video you saw earlier, the need for the global health supply chain is to be resilient and flexible to address the changing demands. So what's the role for India in the global supply chain? Well, India in the private sector has some really efficient systems. It knows how to deliver low-cost generic medicines. Even at quite small retail pharmacy shops in India, there are barcode scanners to record sales, to record inventory. Many of our major warehouses across Africa, containing millions of dollars worth of medicines, don't yet have a barcode system. India has been very rapid in applying new technologies and moving forward to roll those technologies out quickly through the system. We're seeing the latest trend in healthcare logistics is now not just that manufacturers make the medicine, but they manage the supply chain all the way through to the user. So instead of the government ordering and warehousing, the manufacturer uses suppliers to warehouse and deliver to individual clinics and hospitals themselves. Decentralized operation, and logistics vendors undertaking all activities. So perhaps this is the future of the global health supply chain. Point I make again is India is already much closer to the requirements that are needed for the global supply chain than most of the Western supply chain operations. The investment in technology in India has been huge. Nearly every day, new technologies are rolled out and they're rapidly taken up and rapidly invested. It means there's enormous potential for growth, and India has shown great flexibility in adapting those technologies. So what future role could India play in the health supply chain? As we look at activities like artificial intelligence and blockchain, is it possible that India can move from being the pharmacy of the world to being a manufacturing hub into becoming the logistics server provider for healthcare supplies? Because it already is close to what's required for the global health supply chain. So the overall message is the ability is there in India, and it needs to be harnessed to address global health supply chain issues. Okay, we change now to careers. We've talked a lot about global health supply chain, but how do you get a career in the global health supply chain? First, the recognition is that there's a huge shortage of capacity. There is between 30 and 70% vacancy rates in the global health supply chain. And of the people in position, many are poorly trained and lack the skills to fully implement the systems that are required. So there's a great human resource capacity development needed. But most pharmacists will not learn about the global health supply chain at pharmacy school. Most management people will not learn about the pharmacy supply chain either at management school. So there needs to be a crossover of different disciplines, of different ideas, to be able to address these issues and to meet the requirement for the human resources. Empower runs a 5-week course, and on the screen you can see a link to a YouTube video which explains about the course, how you could get started in an international career. The course does not guarantee you a job at the United Nations, but it does explain what opportunities are available, how you could go about addressing those issues, how you could work towards a career in the global health supply chain. Very good video. Please look at the link afterwards. Click on the link to move forward. Additionally, Empower runs a 1-year postgraduate diploma in global health procurement and supply. This is an online course. It's a taught course. It's available in English and French. It's the only one that is specifically in this area for global health procurement and supply chain in both languages. And it's done in partnership with the US Kent State University. It's an excellent course. It is comprehensive in delivering the information required to undertake global health procurement and supply chain management. Empower also runs a large number of courses. They're online from the 12 months postgraduate diploma through to 1 and 2 months short courses. Additionally, for free is available the UNDP course online for the introduction to procurement and supply chain management. So if you're thinking about procurement and supply chain management, why not have a look at the online UNDP course available through the Empower website and just see how you might think about that and how well you can do on that course before embarking upon more advanced courses and looking at the other issues. Good little taste of what's happening, but there are plenty of focused short courses available in this area. You want to learn more? Please go to the Empower School of Health website, where there's a vast amount of information available on different courses. much as in video format, so it's easily listening, easy to see the different courses, the different types, and how they can assist you. Okay, time for open floor and Q&A. I will stop sharing the screen now.
Thank you, Andy.
So for your questions, if you'll please type in the chat box.
Yeah. Indeed, yes. I was just going to say that. That's good. And if you can start scrolling through the chat function, there are some questions there, although some of them are discussions between participants, which is good. That's one of the functions, that's the objective. And to the participants, feel free to mention whether you want Jamia Hamdard or IPHL, or, well, there's no one from FIP, although we are representing FIP and we're members, or to us. So feel free to address that as well. And what we'll do is we'll pick some of the questions and start to respond to them as well. Okay, so Andy, let me just pick one and then you can pick others as well. It says, are these certifications useful for private sector professionals? How does supply chain differ between the two sectors, public and private sector? Very important point. It's a very good question as well. So actually it's a deeper question. There is supply chain in general. And if you, which means people may have studied a bachelor's or a master's in supply chain, which could be operations management or supply chain. And if you're doing an MBA, you can specialize in operations management. If you're doing a master's degree, you can specialize in supply chain, materials management. It's more or less the same thing, but the names are slightly different. Depending on which course you take, it could be non-vertical, non-industry specific. So you can get lots of degrees and certifications, whether it's CIPS or CILT, which are professional certifications, or academic university ones. What we noticed, and the reason why we have created one for health supply chain, is because of the complexity of different products, diagnostics, devices, vaccines. So the better understanding you have of the products, the better understanding you'll have of the supply chain that goes with it as well. You don't need to be a pharmacist. You don't need to be a doctor or a biomedical engineer. That background, in fact, I would say half the people that have joined this profession come from a non-medical, non-health background. Some of us have that. And is there a difference between public and private sector supply chain? The answer is no, but the public sector has some unique features and elements. Often it's linked with how procurement is done, how tendering is done, which makes it more complex and often takes more time. So there's additional information that is needed in some of those elements. If you remember the framework that I shared with you, which included a combination of organizational structure, resources, supporting resources, and then the activities. Some of them may be distinct depending on public or private sector. Okay, let me pause with that one. And if you've found one, Walter, if you've found a question you'd like to respond to, please go ahead.
I think for Walter, if he can, please, I've got one is, how does the supply chain relate to maternal health products? You need to unmute there, Walter. Yeah.
I think the team might have to unmute Walter if he's not a co-host. So team, can you unmute Walter?
There
Yes.
you go. Okay, so how does the supply chain respond to maternal health products?
Well, again, in many of the countries that we're talking about and the global south, maternal health products tend to be in with essential medicines, although different. And if you remember the little video, the move to integration is very strong, and how countries can integrate their products and integrate their systems. So not everything has been integrated, and countries are at different levels of being able to integrate, but maternal child health products are part of that integration. And there is now a new movement to look specifically at that area. It has not had the funding that TB, HIV/AIDS, and now COVID and others have had. They've had, in family planning products, but now maternal child health products have a whole new sort of emphasis. And so they're beginning to look at that, but they tend to be in the essential medicine system, whatever that supply chain system is.
Okay, thank you for that. And
All right, Andy, can I pick one up and then
Yep,
back
go ahead.
to you? Yeah. So one of the questions, Akshita Kukreja asked, since the flaws in our existing supply chain practices have been made apparent, attributed to COVID-19, what are the practices that we can adopt to ensure better preparedness? Really important question, and all the countries, developed and developing countries, are asking this question to themselves, because what has been made absolutely clear is that it's not how rich a country is, but it's the systems that are in place. And there is this tension between efficiency in supply chain and resilience in supply chain. And Andy presented a slide on that as well. If you're looking for efficiency, which means often lower cost, faster timelines, faster delivery, and more concentration of suppliers, you can get away with efficiency when everything, and just-in-time supply chains. That all works well when everything is smooth and there are no disasters. And that also saves money and time. However, anytime there is a disaster like this, or a black swan event as it's called, we have situations where there's complete breakdown. So that is one. One is moving from pure efficiency to resilience, and it's a tough call to make, but people and organizations realize that is the way forward, given all the different changes that are happening in the world. And actually, I would say that's one of the main points, and there's a whole book around that as well that The Economist has published as well. Let me pause again. There's a longer response. Let me send it back to Andy for some of the other questions.
Okay, one question I've had is on cold chain. Can you do intercontinental cold chain? The answer is yes, the technologies exist to be able to do global cold chain. The problem on cold chain is not the intercontinental shipment, it's always the last mile. Always getting down to small rural clinics or places where the medicines are delivered. Equipment and systems exist to deliver vaccines to these areas. It is well documented. The problem is always implementing them, always undertaking them. So yes, cold chain management across the board is certainly possible. There is an increasing movement now for supply chain to take on, for manufacturers to go beyond just providing the vaccine, to go into managing part of the cold chain. That increases. Okay.
Right. Andy, I'm going to send another question to you. It's the work that you are doing with WHO and the 11 Southeast Asian countries, and that is, what resources will be required to update forecasts and supply chains for public health commodities in this pandemic?
Right, that really comes in.
Talk on that.
Right, at the moment, Empower is working with GOAN, with the Global Action Response Network, particularly around the responses on COVID and what's happened and how pandemic preparedness can be improved in the future. Part of this study looks at forecasting, and forecasting in two parts: forecasting for COVID-related commodities in particular, and then forecasting for general medicines in the future. For the COVID commodities, WHO has developed an Excel-based tool to assist countries forecast their commodity needs. However, COVID doesn't just impact personal protective equipment and ventilators. It's impacted the whole of the supply chain. There is some evidence that we are losing ground on the Sustainable Development Goals. Measles outbreaks in Africa because we haven't got the vaccine. COVID doesn't cause measles, but it disrupts the supply chain to get the measles vaccine to where it's needed. And it's clear that we will have to improve public health supply chains and have greater resilience. COVID is one pandemic. We've had pandemics in the past. We can expect pandemics in the future. The lesson from this is we must be better prepared for pandemics. And that means building resilience into the supply chain. Okay, let's see what else we have got in the question boxes. Okay.
Could I add just that I think on IPHL, we're going to be having a discussion of the effect of COVID on the decision-making, because what we're hearing is many countries now are questioning, should they start manufacturing products? Because COVID cut them off. When COVID hit, it cut India shipments, it cut Chinese shipments. So now there's a lot of discussion going on about, is there now this big pressure for countries to produce their own products? And of course, if you think economically, it doesn't really make sense, but there is going to be this pressure. And the second one, as Paul talked about, the whole idea of the efficiency, well, now even the US got caught with being efficient, but not having the supply that they needed in a crisis. So now this gets back into the big discussion about how much you should have. And many of us who've been working on this for a long time, we've been helping countries reduce their supply chains, reduce their pipelines. And now you have an issue of, okay, well, now you did that, but I only had 3 months supply centrally. And now that's a crisis because of COVID. So there's going to be a great deal of discussion and pressure, especially in the Ministry of Health, the public sector, of, or do they have to rethink it? So also staying tuned for IPHL, because I think that'll be a discussion coming. Thank you.
Right. Let me build on what Walter just said, and JSI, Empower, and other organizations, but especially JSI and Empower, are doing a lot of work in building capacity for vaccines and vaccine response. And there's the Global Alliance for Vaccine Initiative, Gavi, based out of Geneva, and they are working very rapidly to introduce the expected vaccines that will be coming out of phase 3 trials into multiple countries. And one of the questions that somebody has asked is how can, like it was about distribution, allocation, how do you allocate products? The question was asked in a different context, but it's directly related. When you have a limited number, a limited supply from the manufacturer side, so from the producer side, and the demand is obviously practically unlimited, if assuming we want to vaccinate, let's say even high-risk people. So let's say we need about 3 billion doses, and we can only produce about 100 million doses. How do you allocate? How do you ration these products? And so Gavi, with its COVAX project, working very closely with UNICEF, which is the largest buyer and distributor of vaccines, will be working very closely. That's one aspect of it. And the global coordination is absolutely critical. Otherwise, what will end up happening and is happening is the United States has basically laid claim to all American manufacturers and said, anything that you produce, America first. But that's not unusual for America. India would say the same thing. Russia would say the same thing. China would say the same thing. If you have developed a vaccine that can protect our population, it is the national government has the authority and the right to ensure that our own people are taken care of first. So here you have a situation where it's a global good. Everybody needs it, but whichever country or whichever manufacturer produces it first, and there's about almost 40 different manufacturers that are in phase 2 or phase 3, and a few of them should be reaching into the market with varying level of efficacy. How do you allocate? How do you distribute? So here is something that is a mix of the rights of an individual, the health rights that was talked about by Walter at the beginning, the WHO right for health. You have a situation of supply, you have a situation of demand, you have a situation of funding. And it is a very complicated situation. Most of us are experiencing it for the first time, and the procurement supply chain teams have to address this. The ethics, the NGOs, the civil society, the governments, the private sector have all to participate in this as well. I pause and send it back to my colleagues to respond. And also I'd like to say, request the Jamia Hamdard, the university team, if there's any questions, topics that have shown up, please, we do not want to be the only ones responding. If you see anything, please let us know and jump right in.
Professor Ray Chaudhary, Professor Saki John, we would like you, if there's any specific points which we have mentioned, which we have not covered, or which you feel that can be discussed. Seeing the queries which are coming, there are many queries which have been solved by the speakers, but there are many queries on the courses, its fees and everything, which we'll take care of. We will also be sending the presentation with the links of all the courses and other thing like how to enroll in the IAPHL, and everything will be sent to all the students. Even the recording of the webinar will be cleaned up and sent to all. So rest, anything else you feel we can cover, Professor Chaudhary and Professor Saki John or Dr. Shibu John? Any
Thank you.
specific
I think
question?
that is good. Well taken by Professor Lalwani, Professor Andy, Mr. Walter, and we are really grateful and thankful to them for educating us and giving a lot of practical evidences and examples. And I take this opportunity to thank Empower School of Health, Professor Lalwani, Professor Andy, Mr. Walter, yourself, Mr. Rahul, the back office, Ms. Sonia, and Preksha. Thank you so much.
Yeah, thank you everyone. I just make one request that, if we find some more questions, so what we can do is we'll compile it and then we will send it across to you. So probably you can answer them lately and we will inform the students or maybe any other participants.
Sure,
Is
sir,
that
sure.
works with you?
Yeah, sure, sir. You can definitely compile all the questions.
Yeah,
and,
Mr. Rahul, I had a list of questions from students.
Yeah.
Many questions. I will mail it to you. I have an Excel sheet. You can give it to Professor Andy, Professor Lalwani. From them, whichever you find interesting and useful for the students, please.
We will surely do that.
I've already shared with Sonia.
Okay.
Those lists.
We will do that, sir.
And also, actually, if you can share this recording of this session and also PPT. Yeah,
yes,
please.
sir. Everything will be shared. Professor Ahmed Kamal, sir. It will be done, and we'll be sharing the link for the PPT as well as the link for the webinar as a resource to the students and to the Jamia Hamdard University to play in their classes whenever they feel like. It will be our pleasure. And being an alumni of Jamia Hamdard University, it is my pleasure, sir, for giving us an opportunity for me to even take this initiative further. And thanks to Dr. Shibu John, Dr. Chaudhary, Dr. Saki John for giving us an opportunity to talk.
Right. Before all our participants leave, can we please have the final poll?
Yeah, that is the last one. And I think everyone should take part in it because it gives a clear idea on that.
Okay. So the poll's on the screen now, please. Before you leave, can you just take a few moments to complete the final poll?
So now everyone has, we have reached 50% polling in 1 minute, which is like everyone has now understood how to do the polling. It's amazing.
I think our participants have adopted the technology all well and demonstrated the flexibility of Indian supply systems.
That's true. That is what the need of the hour is, Prof. That everyone has to adopt the technology and ensure that the right, right products reaches the right patients or the service provider at the right time. So that's what the idea is all about. 70% done. Wow. In 1 minute, 40 seconds. %75% we are reaching now. Come on, guys, we have 1 minute. Please poll, please participate. It helps us to understand better, and it will help us to understand your requirement in future. And in the last minute, I would request everyone to join the IPHL. Please go to the website, read about it. Please join, become a member of IPHL, because then you will be connected to the international fraternity, understand more about global supply chain, which is happening internationally. And specifically for the students, it is important to know the nuances or the advances which are happening in the field of supply chain management. And yes, I know we have a lot of students here, so do join IPHL. Do visit Empower School of Health website. Do visit FIP website to understand what's happening internationally. So, my dear friends, the poll results have come. Over to you, Andy. I think this last thing you should
Okay, so it looks like a lot of people are interested in a career, nearly 70% in global health supply chain. Thank you.
That's a clap required for everyone. Yeah.
Okay, and of course, Jamia Ahmad University, majority of people from there. Majority of people pretty evenly split between email and social media for hearing about us. Most people found the webinar useful, and most people are associated with JHU. Okay, so overall, thank you very much. That's been an excellent session. I'll let Prof. Paul make the final remarks.
Thank you very much, Andy. Thank you very much to our colleagues at Jamia Hamdard University. Again, it was an honor to hear Professor Ahmad Kamal give his opening remarks. And I look forward to meeting you in person one-to-one one of these days as well. Walter, 3:15, 3:20 in the morning. Thank God the caffeine is still in your blood system. Really appreciate that. Your Saturday, of course, is destroyed, so you better sleep in, I suppose. And thank you. For everyone who doesn't know, he's based in the Washington, D.C. area. And I'm sure he wishes he was in India right now. To all the participants, thank you for your insight. Lots of very interesting questions. Several people have asked, could we get a participation certificate? In the past, we have not done this. Let me talk to our partners. I don't see why not. We'll get this organized, and if all the partners are okay with it, we will email you a digital participation certificate, and it's something we should consider in the future as well. So Rahul, please take note and coordinate with everybody on this as well. Okay.
Right, sir. I'll take a note on it.
All right. And more than, I mean, the world, in ending, I'd like to say the world needs, especially in times like this, individuals who are motivated to join the supply chain area. Going back 10, 20 years, people didn't really think about supply chain. Supply chain was always in the basement. It was not an area of focus. Both the public health community and the private sector, health and non-health, has woken up to the importance of supply chain. And just for your information, 13% of the global GDP is spent on logistics and supply chain. So it's a massive area. Now we're even seeing CEOs who came from the supply chain side who are heading an organization, and Tim Cook is one major example, the CEO of Apple. one of the most, if not the most valuable company in the world, is headed by a supply chain leader. So our, of course, focus is on supply chain and global health and bring the two together. My own personal pathway was studying pharmacy, then going into management, and then practicing in the field. More than 25 years in different places, all the way from Kabul in Afghanistan to Sana'a in Yemen to Papua New Guinea, and eventually to calmer places like Geneva and Washington, D.C. and New York. So if you're ready for action, for excitement, being in the front lines, love to travel, this is the career that you should definitely explore. It's not without its challenges and joys. Right now I can see Andy and Walter smiling to that. So thank you again, everyone.
Thank you.
Really appreciate you participating. All the best.
Thank you.
Thank you,
Thank
everyone.
you very much.
It's our pleasure. Thank you, Professor Ray Chaudhary
Thank you.
and the JMIA, the team, and thank you, Mr. Walter. Sorry to keep you awake, but yeah,
Thank you,
it's
Professor
our pleasure
Lalwani, Professor
to join.
Andy, Mr. Walter.
Yeah.
Thank you.
Thank you, everyone. Thank you.
Thank you, Rahul. Mr.
Yeah.
Rahul.
Pleasure.
Thank you, Sonia.
Thank you, Professor Kamal, sir. Thanks for joining and giving us the opening remarks and inaugurating the webinar.